All right, guys, today I'm going to be speaking with Dr. Glenn Charles of Boca Raton, Florida. If you guys are not aware, Dr. Glenn Charles was one of the first surgeons to own and operate the Artas machine, which is robotic FUE. Hey, guys. I'm just waiting for Dr. Glenn Charles to go ahead and join. Just one second. So, yeah, Dr. Glenn Charles actually was one of the first to train people on the Artas machine. How's it going, guys? So he should be joining me shortly. I just sent him the invite, so hopefully he joins me here soon. If you guys have any questions for me right now until he joins, feel free to ask. How's it going, guys? So yeah, so we'll be talking about the Artas. Do you think the COVID vaccine would affect the hair transplant? You know what? I don't know. Not much is known at this point about the vaccine or COVID itself. It may not. It's mute. Let's see here. Sorry. Can you guys hear me? Sorry about that, guys. We're some technical difficulty. Oh, there we go.
Melvin, how are you, buddy?
Hey, how's it going,
Good,
Dr. Charles?
thanks.
I'm doing very good. Yeah, so you can hear me. Someone was saying that I was muted, but you can hear me, right?
I can hear you.
All right, perfect. All right, so yeah, I just wanted to let the community know here. This is Dr. Glenn Charles. He was actually one of the first people to own and operate and train other surgeons on how to operate the Artas machine. Correct? And the Artas is something that's a debated topic, and I wanted to ask you, since you're probably one of the best people to ask, is it a viable option? Should patients be choosing a doctor that uses the Artas as opposed to a doctor that does manual or motorized punches?
Well, that's a little bit of a tough question to answer because I do know some decent doctors who do have that as one of their FUE options, and in the right set of hands, it can be used well and it can come out with a decent result. However, I think that there are a lot of doctors out there that are buying the machine because it does so much for you that you don't really need to know that much about hair transplants.
Mm-hmm.
And they're using it as a tool to add another procedure to their repertoire, something that they really don't know enough about, and therefore the results are coming out poor.
Mm-hmm.
In my experience, and again, I know you mentioned that I was one of the first group of doctors to even have the robot. It just it had difficulty with a certain amount of patients, a certain type of patient, I should say, and there wasn't at the time there wasn't as many options available for it. Now I haven't used it in a couple of years, and it's certainly possible they could have come out with some new software that does give some more options for the doctors that are using it. I've gone to more of a automated manual device that takes a little more time for me because I'm doing it myself. But I just think the results are coming out better. And that's really, for me, that was the bottom line, is just higher graft survival rates, less transection, less wasting of donor, because people only have a limited commodity of donor to begin with. And once you've used up everything that's in your bank, that's it.
Yeah. And correct me if I'm wrong, but another issue that was being discussed with the Artas machine was the size of the punch was actually a little bit larger than what is normally used with,
That's definitely true back when I used it. Even when I compared the 1 millimeter punch from that versus a 1 millimeter punch from an automated manual, it seemed like the hole was actually bigger. And I think it was because the thickness of the actual metal tube, or we call a punch, was thicker. So the entire hole was actually bigger, even though the measurement of the inside of the diameter of the punch was 1 millimeter.
Fantastic.
But then again, they may have changed that now too. So I don't want to really, make any claims that I am, 100% up to date on exactly what's going on with the robot at this time. I can only really speak to it as of maybe about two years ago and before that.
Yeah.
So I mean, they're very smart people, and I know that their goal is to put out a good product and to get good results. I don't think they have bad intentions,
Yeah.
and I would hope that their R&D department is on a continual basis taking feedback from the doctors and making adjustments and changes to try and improve their product and then improve the results for the patients.
Yeah. Yeah. And I think what you said is, I think the biggest takeaway is that, there's some skilled doctors that are using it, and the ones where you see poor are generally doctors that don't really have that much experience with hair transplants, and they're thinking that they're just going to buy a turnkey machine that's going to generate more income for their practice, which is that's sort of like the negative stigma that has sort of come with these type of machines like the NeoGraft and the Artas and stuff like that.
Unfortunately, it happens to be true. I mean, I can just give you examples of local plastic surgeons down the street from me that they've been there for years, never did hair transplants. And all of a sudden now I see them advertising for NeoGraft, and they're doing hair. Now they're an expert in hair transplants. I don't know where they're getting their technicians from, but the other unfortunate thing is I can't say this about Artas, but I can say this about some of the other companies. I don't like to mention names. They actually offer the doctor that if he expresses some uncomfortableness about not knowing enough about the procedure to the sales rep, they basically tell you, like, we'll send the reps, we'll send the technicians for you. We can supply you technicians.
Wow.
And I've heard some really crazy stories about local doctors in my area. Again, I'm not going to mention names. I'm not here to trash anybody.
Yeah.
I'm here to make a point about the concept of this whole thing, and where the doctor barely even sees the patient for just 2 seconds in the morning, doesn't design the hairline, doesn't do nothing, leaves before the patient's even done. It's unbelievable.
Yeah. And that's the sad part. And it's sort of marketed as this, cutting edge technology that's going to guarantee the results, but it's just not true.
Right.
Someone had an interesting question, and I don't know if you'd be able to be able to answer this, but he asked about whether or not the COVID vaccine would affect transplanted hair. I guess he had a hair transplant 3 months ago and had the COVID vaccine. Wondering if
I think that the COVID virus is certainly, we're seeing an increase in hair loss with patients who have had COVID. Now, I think there's probably a good chance that these patients were genetically programmed to have hair loss at some point in their life, and that this is a stressful event that is speeding up the process.
Yeah.
That would be my theory on why this is. I can't see. I mean, anything's possible. And I'm not a geneticist, and I'm not an immunologist, and I'm not an expert on and COVID and all that related stuff. But I can't see someone who does not have the gene for hair loss at all. No, doesn't run in the family. There's no gene in his body, and they have COVID, and all of a sudden they have permanent hair loss. I think in that case, if someone had hair loss, it would be more temporary.
Yeah.
People who are supposed to lose hair later in life, they can go through any kind of stressful event, any kind of sickness, cancer, a car accident, death in the family, COVID, and all of a sudden increase in their hair loss, and it just pushes everything forward.
Yeah. I think that makes a lot more sense. You get like telogen effluvium when you get stress triggers your hair to start shedding, and that's going to cause hair loss. And like you said, someone with a genetic predisposition to hair loss
Right.
that could rate it. And yeah, I think that
Permanent for that type of person versus someone who didn't have it. Like an example, because patients ask me this all the time,
yeah.
and I tell them, like, for example, let's say you have two men in their early 30s and they both have cancer,
Mm-hmm.
and they both have to go through chemotherapy and radiation. Very unfortunate for both these people, but this is just a scenario.
Yeah.
And one gentleman had a lot of the genes for male pattern hair loss. Neither one of them had any real hair loss to begin with before the treatment, and they both lose a lot of their hair due to the chemotherapy. And the gentleman who didn't have any of the genetic predisposition to male pattern hair loss, androgenetic alopecia, all his hair came back. The other gentleman who did have that kind of in store for later in life, a lot of his hair came back, but you could see all of a sudden like the outline where the male pattern baldness was going to occur later in life. He didn't get it all back.
Yeah. Yeah. And that makes sense because sometimes something can trigger your hair loss, right? Like if you, for example, somebody, like I was going to ask you about testosterone replacement therapy, right? Like a guy could have all of his hair, but start taking, TRT, and that could potentially accelerate some of his hair loss, and he could start seeing some more hair loss
Yes,
coming.
I've seen that many times. I actually used to do quite a bit of hormone replacement therapy, which I've kind of gotten away from that now and just doing hair alone pretty much. But again, someone who has the gene for hair loss, you start dumping more testosterone into the system, you're going to get a higher conversion to dihydrotestosterone, and therefore it could speed up the process of the hair loss. Tons of bodybuilders and guys who weren't having hair loss to begin with, or guys, or even non-bodybuilders, just guys who are realizing they're low on testosterone and see a hormone replacement therapist specialist,
Yeah.
and start getting supplemental testosterone, they're seeing an increase in hair loss. That's why I wish more of those doctors who do that looked at the patient, questions, and said, listen, if you're already, especially if they're already showing signs of hair loss, which a lot of them already are, not bad yet, signs, that doctor should be looking at that patient and say, listen, you clearly have male pattern baldness, the beginning stages of it. If we add testosterone, there's a good chance that this might make this progress faster than it would have normally. Maybe we should consider like a DHT blocker. Very similar to most of the doctors will tell the patient there's a higher chance of getting a higher conversion of the testosterone to estrogen, so we might need to give you an estrogen blocker so that you don't get maybe fat tissue on your breasts or extra fat tissue in the belly area or any other kind of estrogen related symptoms. We're going to give you a blocker to offset that. They don't talk about the hair too much.
Yeah, and that's a shame. So the person who actually asked that question just said, so should I get the vaccine if I got a hair transplant? I don't know if we're equipped to answer these type of questions. I mean, I can't see how the vaccine would affect transplanted hair, but again, that's a medical decision. You should probably
No data. I am not in the. I don't feel comfortable either telling people they have to get the vaccine or shouldn't get the vaccine.
Yeah.
People should do what they feel is right for themselves, and I respect other people's opinions and decisions.
Yeah, I think that's probably the best way we can put it, because we can't.
I don't think, I can't imagine that getting the vaccine would save the hair transplant. And I don't think just the vaccine alone would not make the transplant work either. Again, the vaccine is so new. There's no way that we could give any data or any real information on that anyways.
Yeah. And so talking about TRT, there was a pretty big thread that came on the forum last week, and it was a guy who was, interested in getting in TRT. He was in his 40s, his testosterone was lower, and so he was wondering if you get on TRT, is finasteride alone enough to stop the hair loss, stop the excess DHT from being created?
A lot depends on how much testosterone he's taking, what are the doses, how does he responding to it, what are his normal levels of testosterone to begin with, what numbers are they trying to bring him up to, how strong the gene is for androgenetic alopecia that he has. There are so many factors, but you know, some people will try multiple things. They'll try a natural DHT blocker, a saw palmetto, or they'll do the minoxidil or Rogaine also, laser. Some guys everything they can to salvage every single hair that they can, and some guys pick and choose their spots, and it's an individual situation.
Yeah, yeah, and I think that there's also dutasteride, right? Because dutasteride blocks is the two types of DHT. So if finasteride doesn't work, you could potentially,
You could try it. You could try it. They're calling it a stronger DHT blocker because there's two pathways your body can convert testosterone to dihydrotestosterone, and finasteride blocks one of the two pathways, or the enzyme that converts it blocks the enzyme. And dutasteride blocks both pathways. So technically it should further lower your DHT levels.
Yeah.
Could that have other side effects? Possible. Could it be more helpful in preventing hair loss? Possible also.
Yeah. Well, here's what would be my question, right? Is we know that DHT stops aromatization into estrogen, right? So if you have a lot of testosterone in your body from TRT, what is going to keep it from converting into estrogen now? Because that's another thing that is a problem with guys that are taking TRT, right? Because you could develop gyno or, you know, these other things from aromatization and stuff. So when you have DHT, that kind of stops it. That stops, you know, because it's the testosterone is converting into DHT as opposed to.
I see what you're saying there. So you're saying that by potentially taking testosterone replacement therapy and lowering your DHT levels, that could be an increase of having higher levels of estrogen.
Yeah.
Well, therefore, maybe an estrogen blocker would be the call for that.
Okay.
I mean, most docs are aware of the potential elevated estrogen levels. That's pretty common for those specialists to be aware of that and to keep an eye on that. So a lot of people who are on testosterone replacement therapy are also on an estrogen blocker.
Okay.
It would be that those who are on a DHT blocker should even further consider, even higher consideration for taking a blocker in addition.
Yeah. I think that makes sense. I also, a lot of people nowadays say that, the strip is an outdated technique. I've seen a couple of YouTube videos from YouTubers saying that, they don't advise anyone getting the strip. Now, as someone who performs both FUE and FUT, what are your views on that? Is the strip technique really an outdated, primitive technique that no one should be getting?
My personal opinion is no. I think if you speak to doctors who only do FUE, you're going to probably get a different answer than doctors who offer both procedures still. I, in fact, just recently posted on Instagram me actually removing a donor strip, the actual removal of the strip itself. So it was a little bloody, a little gory.
Yeah.
I was trying to show that with the proper technique, you can get that blade in between the two rows of follicles and get all the way across without transecting any follicles. And then the rest of the strip would be dissected under a microscope where you can actually visualize the follicle.
Yeah.
And one of the comments was something to what you're getting at. We're like, who's even doing that procedure anymore? That's FUE's way to go. That's it's archaic.
Yeah.
And I responded something, not mean. I was not trying to defend myself. I was just trying to say, like, listen, like, unfortunately, everybody's not a candidate for FUE. And the FUT is still a very successful procedure. And you're only talking about a difference in the type of scar that you get. The one surgery leaves a single, should be tip of a pencil line scar if done properly.
Yeah.
Potentially thousands of little dots all over the back of your head. I tell people either way, if later in life you decide, I'm just going to shave my head, I'm going to take a shave and come in a razor, you're either going to see a line or you're going to see lots of dots.
Yeah.
Not like someone who gets tons of FUEs can just shave their head bald and not see anything.
Yeah, that's at 3, so absolutely. I can't do that.
So, and then I tell, there's maybe some younger guys who, they're really kind of against the FUT thing, and I get that. And I said, there is some options, though. I think every patient has if you're a candidate for FUE to begin with, there's a breaking point as to how many of those you can do on a patient before they're going to start looking too thin.
Mm,
How
yeah.
how many you can remove before the dots start to be so many and they start to connect and there's nowhere to go that you haven't been before,
Yeah.
and looking moth-eaten. And then to remedy that situation or cover it up, you got to grow your hair longer for that situation also.
Yeah.
You might have to cover your hair longer to cover a linear scar, and you might have to grow your hair longer to cover lots of FUE scars. That's possible also. But the other option for some patients who are not sure, but they really are hesitant about having the linear scars, I tell them, right now your density is, average or a little bit above average, so we could do an FUE. But if in the future you lose more hair and you want more procedures, at some point I may tell you that I don't recommend any more FUEs. And at that point, you could switch over to FUT. Just because FUE doesn't mean you can't do FUT. Now, the other way around doesn't make as much sense, although I have had patients who have had FUT in the past and said, I'm just not doing that again. The concern with that is when you have a linear scar, you need as thick as hair as possible above the scar to cover the scar.
Yeah.
If you start doing FUE, you got to be really careful about the hair that's just above an FUT scar, because now you could potentially be lessening your ability to cover that scar. Now there's the scar, there's SMP, which I'm sure we're going to talk about in a little bit, into the scar also. I guess supposedly someone could do SMP on all the dots too. I mean, that's a pretty complicated job. I guess it's a possibility. So there are options.
Yeah. And I think that also, if honestly, if you want to get the most grafts, you probably got to do a combination. And that's the point I'm at here. I've had 3 FUEs. My hair looks pretty good, but the crown, I got to use Topic because the crown is it's pretty bare. There's just no way I'm going to personally get all the hair with just FUE. If I want to get more, I have to just say, okay, either I'm just going to keep using that, or do an SMP or something, or get a strip. I mean, that's just that's the reality that you have to kind of accept, especially if you have a lot of balding. If you're like a normal.
Grafts have you had each time?
I've had about 5,300 grafts in total. So about like first one was like 1,800, second one was like 2,100, and the last one was like 1,300.
Okay, so you've had quite a few.
Yeah.
You're getting up there, and you got to start being concerned about, is the back going to continue to look normal, or how long am I going to have to keep my hair in the back just to make it look full?
Yeah.
Those are considerations. I do comment people. I think that, it's probably true. The way to get the most total grafts removed from someone's scalp and have the back look relatively normal still.
Yeah. Yeah.
I also think that, if you want to directly compare the two, let's say you're doing 3 2,000 graft procedures, 3 2,000 FUE procedures, and 3 2,000 FUT procedures, where you keep going with the FUT. On the second procedure, you go along the same path, you remove the scar. Same thing. You have one scar, which is a little bigger than it was originally, because there is a little bit of a cumulative effect with scarring. Yeah. And even though when we go in on a FUT strip a second time or a third, we're attempting to remove the old scar as much as possible, you can't get it all. And generally the scars get a little bit bigger each time, generally.
Yeah.
But I think that that person who had the 3 2,000 FUTs, even though they have a scar, as long as they have a little bit of hair, we could even compare the exact same length of hair, I think their hair would look thicker than the person with the 6,000 FUEs.
Yeah. Oh, absolutely. Yeah, for sure.
So I guess, there's a pro and a con for both directions.
Yeah. Yeah, for sure. And I mean, the FUEs, I think that if you're like a person who really likes to wear their hair short, which I do, I think in the beginning, FUEs, that should be your choice. But if you continue to bald, and let's say you were like started off as a Norwood 4, and then as you get older, you hit 40, now you're a Norwood 6, you got a crown opening up, you just have to accept it. You may need to one day opt for the FUT if you want to get more hair transplant procedures, because then like you said, you don't want to just remove too much, and get moth-eaten. So someone asked, and this is a pretty common question, what's the best age to get a hair transplant?
There
Is
is
there?
no. I think that in general, younger. It's more important to people that are younger.
Yeah.
But then people's lives change as they get older and things become important again. So I think you definitely want to be old enough to make a wise adult decision. And I think that the younger the patient is if they decide to go forward with that, the more conservative the doctor needs to be,
Mm.
because the more years of potential hair loss ahead of that young patient.
Yeah.
So I mean, I don't all ages. I don't have an exact age limit, minimum, maximum. I kind of take each patient's situation individually and just try and make sure that their expectations are realistic. That's the key. If you start with someone really young, you just can't commit to a super low hairline. You got to keep it a little elevated and say that even though you can get away with something lower now because you have a young face and you are young,
Yeah.
this has to look good, 10, 20, 30 years from now.
Yeah.
And I might have a lot more hair loss. And I want to make sure that we keep enough donor in your bank in case we need some for later in other important areas.
Yeah. Yeah. And that's sort of like the crux of the issue, is because usually when you're like, let's say, a 21-year-old guy and you have some recession, maybe, some slight temporal recession, understandably, they want a straight hairline, just like all the other 21-year-olds they see. But their dad is 45 and is completely bald. You have to assume that he's going to progress in the same way that, his father, his grandfather, brother, stuff like that. So, making them understand, what's the best option for their situation.
Right. Keeping worst case scenario in mind.
Yes.
Yeah, I tend to do that. I take very detailed family history. Unfortunately, there are some patients that just don't really have a great family history. They're adopted. Their father, they just don't know enough about their family. And the other thing is sometimes you get people coming like, both sides of my family got great hair. Well, you can skip a generation.
Yeah.
There's other possibilities. We won't get into all of them.
Yeah. I mean, and that's true. Like for me, for example, like my dad is 63, he's probably maybe a Norwood 2. My brother's 44, hasn't lost any hair. I unfortunately turned almost Norwood 6 by 30. So sometimes, yeah, it can absolutely skip a generation. I think that's also important to say that, these kids may come and say, hey, I don't have any baldness in my family. Just lower it as much as you can. I don't care. It's not going to happen to me, which it's not true. It could end
I've
happen.
turned some patients down. They're asking me to do something I think is just really unreasonable, and at least to me unreasonable, and it's just a bad idea. And I just don't want to have someone come back later and say, Doc, you knew better than that. You should have told me that, or you should have not let me do it. I say, I did tell you that. I even wrote it in the chart, but
Yeah.
you still did it though.
Yeah.
I have turned some people down who I thought were just asking for something that was really unrealistic, especially for the potential future problems that it might bring.
Yeah. I think, I don't know if you'll agree with me, but I think a good age, at least the base minimum age, in my opinion, should be 25, 26. Because I think at that age, even if you were to, have aggressive balding, you would see the signs for sure by that age. And also, I feel like before that age, your prefrontal cortex isn't even developed yet. So you may be making decisions just based on emotion without really thinking it through and thinking, okay, is this going to be really what I want? Because a lot of guys are okay with shaving their head. And
Right.
maybe beginning, the initial emotion is like, I just want to get this fixed. I'm going to get a hair transplant. And then, maybe these guys turn 30 and they start losing more hair and they don't want to keep having hair transplants. And they want
I to come in. I have young patients who come in. They're debating whether or not they should, just shave their head or And I tell them, go home and do it. I think you should try it because you may like it. Your friends might like it. Your girlfriend might like it. Your family might like it. And then you're saving yourself a lot of issues. And then, or determine that you do not have the right shaped head for that and realize that that's absolutely not a good idea for you.
Yeah.
But at least you won't wonder all the time, maybe I should have just shaved my head. So I've done before, but I don't know if I have an exact, like I said, exact age. I think that the age you were talking about makes sense what you say, but there's always exceptions to the rule.
Yeah, yeah, absolutely. Yeah, there's always exceptions, especially if someone's like 22 and most of their hair is already lost. I mean, you could.
What they're asking for is just a little frontal island just to have frame their face a little bit. That's not unreasonable.
Yeah. No, yeah, absolutely. I think there's definitely exceptions to the rule, but just in general, I would say probably, that's probably the age bracket I would say is pretty safe to move forward.
Yeah, that makes sense.
Yeah, younger than that, is where it starts to get a little
right.
icy.
They're 70s and 80s, so I don't think there's anything wrong with people still wanting to look good. And good about themselves, look younger. There's nothing wrong with that. I don't think that the opposite end of that thought process, where like I just don't care what I look like, I don't think that makes someone a better person.
But it's just not true. It's just you're gonna even when you're that's why do you think there's so much emphasis on being optimal, right? There's all these clinics that are age regeneration clinics, which offer TRT and offer these things that as you age, if you don't have to accept it, why would you? If there's modern medicine that can rejuvenate you and restore your hair, make you feel better, make you optimal in your hormones, why wouldn't you do it? I mean, it makes total
cosmetics. So I'm right with you.
Yeah.
But I respect other people's thoughts, and I think that there's an overkill. There's a point where you're going beyond what's even makes sense, and it's almost ridiculous. But I think some general maintenance as you age and trying to be healthy and feel good inside your body and look good on the outside and feel confident about yourself and maintain your self-esteem. There's nothing wrong with that.
Yeah, absolutely. And I wanted to ask you because I've also been interested in this, and there's a lot of interest in guys wanting to get SMP as a thickener. Maybe not necessarily like they don't want to shave their head and get SMP, but they want to get it to sort of like lessen the contrast of their scalp, so their hair looks a little bit thicker when they can kind of comb it back and sort of like it'll look thicker. Do you think it's a viable option?
I do. I think that the reason why people's hair is giving the appearance of thinning is one, it is thinning, but two is that because there's not as much hair as there used to be, there's a less volume, more light is coming down and hitting the scalp, which is always usually a lighter color than the hair in most cases, unless you have white hair or super, super blonde hair.
Yeah.
And that's why guys who have super, super light color hairs usually don't notice their hair loss as early as guys who got dark hair.
Yeah.
Realize until it gets really out of hand. So to put some darkness on some of those lighter spots that the light is hitting, it's a visual thing. It's not actually making your hair thicker, but it's making your hair look thicker.
Yeah.
That's just as good. It's it's similar to what the powders, the Topic and those different powders do. Those are blocking, those are putting darkness on the scalp and making less lighter spots, light hitting those lighter spots and giving the appearance of more thickness.
Yeah, absolutely. Especially like Dermatch, right? That is just the tint. So I think I asked Dr. Connier made a pretty fantastic statement. And he said, what's baldness? Baldness is seeing scalp. If you don't see scalp, you're not balding. That's pretty much what it is. And if you're not seeing scalp through the hair, you're not going to see that you're thinning.
I mean, I tell my patients that, they come in, they have a significant amount of hair loss and only average amount of donor. And we're able to just give them some hair, enough hair to be able to use the Topic. So
Yeah.
this topic really, that product in particular, and those microfiber topics that are in the same category, those,
Yeah.
those things stick to hair.
Yeah.
When you put it on bald scalp, it kind of looks like shoe polish.
Yeah. Yeah. Yeah.
Those particular products need hair to stick to, but they work great though. I mean, it's
Oh, I
unbelievable.
mean,
Uh,
I
it does cause some limitations with sweating and working out and raining and swimming, and so there are issues with it. And obviously, people did the scalp micropigmentation, though they might not have as many of those issues.
mm, yeah. I've heard though, and what's your opinion on this? I've heard that if you do sweat a lot and work out a lot, that it can cause the ink to fade sooner than it would normally if you weren't an active.
More sun exposure, more sweating does cause ink to fade more, and you probably would just need touch-ups more often than someone who didn't sweat and get as much sun exposure as you did. But that,
Mm,
I mean, but all SMP patients should know that at some point you're going to probably want to do touch-ups. They do fade. Some
mm,
part of it is your body's, how much oil's in your skin,
mm.
sweat, how much sun exposure you get, and the type of ink that's used. I mean, the higher quality inks don't fade as quickly as poor quality. And that's the other thing. Yet, if we're talking about SMP in general, people need to be really careful. And if they're going to consider this, to only go to someone who does SMP, scalp micropigmentation,
Mm.
tattoo specialists who specializes in body tattooing, because they're
Oh,
completely different. A black ink used on the body is not the same as a black ink used for SMP.
mm,
Black inks that are used on the body from most tattoo shops are made from several different colors. And when they fade, it fades. Those colors show up, green in particular.
yeah.
Good quality SMP inks are made from all different types of black inks.
Mm,
So when they do fade, it's just a lighter color black, not some other unusual color.
mm.
Well, I think a common question for people that are considering is, hey, what happens when I get older? And I said,
Yeah.
gray, or if I want, salt and pepper or gray. So tattoos do fade, and they can actually also be retouched up with lighter colors. They can actually lighten up the actual tattoos also. So there is an answer to that.
Yeah. Okay. Yeah. And I've often thought about that myself. And so you could get like a lighter color or like a gray.
You can start adding some white to it or some grays or something like that to start lightening up and tone it down as you decide to let your hair go lighter in color.
Absolutely. Somebody asked, stem cells are they available for hair loss yet?
Well,
Like a
loss cure. I got
yeah.
a question.
Yeah.
A cure, no. Are they available for hair? Yes. I mean, there's exosome injections, there's stem cell injections, but there's no cure for hair loss yet. There's been some positive things that have happened, and there's been a lot of not much has happened.
Yeah.
For people that have gotten these types of treatments. A lot of trials are going on right now. I'm doing a trial here with exosomes. I know there's Dr. Dan McGrath in Texas doing quite a bit of stuff with exosomes. The exosomes we're actually dealing with are from different sources, so I'm very interested to hear what's going on with them because, again, I'm just trying to find a way to offer more for the patients, more options.
Yeah.
I think that stem cells and or exosomes. And exosomes are basically the material that stem cells release to send messages to other cells. So
Mm.
there is a connection between the two. They're not the same exact thing, though.
Yeah.
An exosome is actually not a cell. You can't get a disease from an exosome. It's acellular.
Yeah.
Although they're screened for everything anyways, and sterilized, but it's a different type of material. But I think that between both those or one or the other will play a larger role in hair restoration at some point in all areas of medicine, including hair restoration. I don't know how far they're going to be able to take it and how much, but it's an ongoing process and there's a lot of money being spent on it. And I hope that it's, I can't tell you how many times I still get asked about just cloning. or
Hair?
hair multiplication.
Yeah.
People call it cloning, but it's really hair multiplication. And it's amazing to me that they don't have it yet. You know, they can clone a sheep, an entire
Yeah.
animal, but they can't clone hair.
Yeah. I wonder what the issue is with that. I mean, I don't. Do you remember Enter back in like the 2000s? They were like they were gonna create.
And they came out. I think that their stock went really big, and then they said like, well, it's going to be like another 10 years before we can release any of that to the public. Like more studies need to be done. So I haven't heard anything since.
Yeah.
I know again, a lot of money being spent on that. I mean, you're talking about just taking a sample follicle from someone's head and being able to replicate more follicles with that DNA.
Yeah.
It's amazing how much money's been spent and they don't have it. It must be much more difficult than than the average person would think it would be. Otherwise, these scientists would have this by now. But
Yeah.
I pray for it every time I go to bed. So because I just know that there's so many people out there that just don't have enough donor to get done what they need. Either they started the process, don't have enough, or didn't even have enough to get started with. I do think that if they ever do get it, company has the patent on that, it's going to be start off with.
Oh yeah. Can you imagine? How much is hair worth to you? 100,000.
Surprised how much some people will spend though. So.
Oh yeah, absolutely. I mean, especially if you're very wealthy.
Yeah.
I would be like, okay, if it's out there.
I'm still hoping that does happen at some point.
Yeah, I truly hope so. So yeah, I also wanted to ask you a little bit about like PRP. What are your views? I know that you offer PRP, and that's sort of like a little bit like exosomes, right? But this is more of it sort of like generates the hair by different growth factors and stuff like that, if I'm understanding it correctly.
Well, PRP is a blood draw from the patient themselves, and the blood is spun in a centrifuge, and it's separated into growth factors and proteins and platelets, and then the red blood cells are discarded.
Mm-hmm.
And this can either be done as a standalone treatment by itself, or it can be done in a combination with a hair transplant procedure. When we do it with a hair transplant procedure, we use it in, I want to say 3 or 4 different areas of the surgery. I generally, if we're doing a FUT, I will actually spray a little bit of the PRP in the donor wound before I close it. Mm. We also put it in the Petri dishes where the grafts are being housed, waiting to get placed. Mm. And then we also inject a little bit in the scalp where the grafts are. And then we also put a little bit on top of the scalp at the very end. Mm. We use it, at least that's the way we do it. Yeah. I'm sure there's many different protocols. And I don't think there's one necessarily exact right protocol and a bunch of wrong ones. I think that they're all could be helpful. I have mixed emotions about PRP. I think that I have seen some pretty interesting results with it, but I've also had many patients that we've done that we didn't see anything happen at all. That's more that when I make that comment, that's more in the patients that we're doing the PRP standalone treatments, where we're just doing PRP and then we're watching and we're what happens. I think that often people say that their hair feels maybe a little higher quality, texture-wise, a little scalp a little healthier. But I don't necessarily think that's going to take a bald spot that's been there for years and just put hair on it.
Got it, yeah.
Otherwise, we would just be doing PRP on everybody. We wouldn't need to do hair transplants anymore. Yeah. And I say the same thing about laser. I mean, I've seen laser do a lot of good things for a lot of people, but I've also seen patients that use that laser religiously 3 days a week, as prescribed by the doctor, and not much really changed for them. Yeah. So I just think that, like most things in medicine, different people respond differently to the same treatments. People, depending upon what's causing that particular problem for them and just how their body reacts to that type of treatment, that's why you're going to get different responses. Yeah. And I think that's pretty indicative of what I see on the forum too with PRP is some get good results, some get okay results, and some don't get any results. like we offer it. I don't say you really should do it because you're going to get a much better result. I don't think that's fair to do that to the patient.
Mm.
Really enough concrete data that really supports that. I tell the patient the same conversation we're having. I've seen some nice results with it. I've seen some patients who didn't seem like it made much of a difference. I've never seen anybody hurt by it.
Yeah.
It's your blood or competitive
Yeah.
blood, and some patients just say, if there's any chance it can help, I want to try it. And there's other patients say, like, if it's not like for sure that it's going to help, then I don't want to do it.
Yeah.
I understand both those points of view.
Yeah, absolutely. Somebody asked me if I could show my crown. I use Topic, so it's not really going to make a difference. But if you want to see how good Topic works, I'll show you. So,
I mean, the fact that from the camera here, it's like you have no thinning at all. What are you talking about?
yeah, I mean, hair.
Have some hair in the crown, or is it shiny?
No, I have some. I have some hair in the
Okay.
crown. Yeah, I've had maybe like 700 grafts placed in the crown.
A handful of hair back there, something for that stuff to stick to.
Yeah, yeah, absolutely. Yeah. Otherwise, yeah.
So that even for people who don't necessarily have enough donor to do the whole thing, there may be some other options that they can do to make it look like they have the whole thing.
Oh yeah, absolutely. And that's why I always tell people, like, look, you can get a hair transplant, and there's things that you can do to augment the results to make it look even better. You can style your hair a certain way. You can use, these fibers, tints, and different things like that.
Right.
That will make it look like you would be amazed, at how good your hair could look. There's somebody just asked, is S&P? We touched on that a little bit earlier. Basically, yeah, it is a good option. But if you want, I'm going to save this video and you can re-look at it, and you'll see what Dr. Charles had to say about it.
I think it makes a big difference on the skin type.
Yeah.
As far as SMP by itself, just as to make it look like hair, I think that works better on darker skin tones. As to make it look like a hairline, and just like someone who bought hair. I think lighter skin types, it doesn't look as natural as darker skin types. But as far as filling in and making it look like more hair on someone who's got some hair, that can for almost all skin types.
Yeah.
Maybe with darker skin types, it wouldn't be even as good for that as it would be with skin types.
Yeah. Yeah, and I think it also is like if you get a hair transplant and you can use this in combination, right? Like get a hair transplant and SMP, fill in the scars, get a little hair, and it could look, especially the hairline is really the thing where you need to have 3D hair.
Right.
Because if you don't have 3D, even if you shave it, you can see when it's just ink as opposed to grain.
Which is dark skin types, sometimes you really can't tell.
Oh yeah. On dark skin types, it's a lot easier. But on someone who's like got pale
barber and they just buzz it off and it can look really good. And sometimes those patients are better off with that because darker skin types can have very light colored scarring in the donor area, and to get that same amount of work done to give that look up front, you could end up with a lot of scarring in the back.
Yeah.
So if you want to keep the hair short, it may not make sense to do the transplant. SMP might make more sense.
Yeah. So he's asking, what advice would you give a 26-year-old losing significant hair?
Go see a hair transplant specialist. Contact one. I mean, even if you don't live in an area right now that there's any really good hair transplant doctors or any at all, everything's can be done, via telemedicine now, virtual. I mean, luckily for me, I've been doing virtual consultations for over 10 years. So when COVID came around, it wasn't like a new thing for me. But I think that you want to look and see what your options are. You want to take, kind of gather up your family history. So whenever you do speak to someone, you'll have a lot of information for them. And then also consider starting on something right now to try and prevent it from getting worse than it already is. Try and salvage what you have, and then start thinking about, does it make sense to start replacing anything yet at this point? But down and getting control of the situation should be the number one option right now. On someone that, with a strong family history already showing signs of hair loss.
Yeah, and you know, so you're saying he's tried laser therapy and minoxidil. Look, honestly, laser therapy's hit or miss. Minoxidil, it doesn't necessarily regrow, in my experience, doesn't regrow hair, but it does maintain more hair. Like I've noticed when I've been off of minoxidil for an extended period of time, I start losing. I feel like my hair is losing more, like I'm losing more hair. So it is a good maintenance medication, but it's not gonna regrow your hair. It's not gonna make a huge
I
impact.
say the same thing for Propecia. Propecia is not meant to grow hair. It's meant to
Yeah, yeah.
stop the
But the
control of it. But you do need to realize that with these treatments that you're mentioning, a lot of times patients don't realize whether or not they're working or not. Staying the same for 2 years, that is working.
yeah,
If you're not losing ground, that's working. Just
yeah,
gaining ground does not mean it's not working. I think it's a big misconception again for people. Like, I tried it for like 2 years, my hair didn't look any better, but it looked the same. I'm like, same, that was working. And then
yeah.
taking it, and then 3, 4, 5 months later, they're like, oh my gosh, how much, I can't believe that stuff must have been working, because now it's much worse.
Yeah, absolutely.
Most of those people try to come back on. Some are lucky enough that it actually comes back, and some miss the boat on it.
Absolutely. So somebody asked your name. This is Dr. Glenn Charles of Boca Raton, Florida. And I'm with the Hair Transplant Network. My name's Melvin, and I do all of the content and moderate the forum there. So if you guys have any questions, definitely feel free to reach out to Dr. Glenn Charles on a more one-on-one level, where he could probably explain things or talk over options with you.
Right. And does your thing show what my Instagram actual name is? No.
I don't believe so, but I'm gonna tag you once I save the
Oh,
video.
okay, cool.
This can go on your profile. So feel free to send a DM.
I'm always on the forums.
Yeah.
I answer questions for patients. I'm just trying to educate people. I realize there's lots of good doctors out there. Unfortunately, there's probably more not so great doctors out there doing hair transplants, but there's plenty of good doctors out there. Do your research, do your due diligence, ask questions, don't make quick decisions. And there's answers available for you, especially on the forum. I've been involved with the Hair Transplant Network, Hair Restoration Network for almost since the beginning.
Yeah, yeah. It's been,
one of the first group of doctors to be on it, and
yeah.
I think it's a tremendous source of information. I think that they're very non-biased, and they're just trying to educate the public and let the people know what's available, and to try not to make any mistakes, and make the best decisions possible.
Yeah. And just before you go, I wanted to ask you this one question, because I feel like I see this all the time coming on the forum, that there'll be a group of anxious guys that are, maybe they're at 6 months or 7 months, and their hair isn't grown to the level that they want. And so they start to, blame the doctor or say the procedure's a failure. But like, in your opinion, why does it take 12 months? Or what is your take on slow growers? Why does this occur?
Unfortunately, the surgery itself is just more successful on some people than others. That's a fact.
Yeah.
And then I think that people's growth cycles are different lengths. So some people are lucky enough to, after 3 months, they're getting the new growth already. So at 9 months, 6 months of actual growth already. But if you're a longer sleep cycle, and you're not getting beginning growth till 5.5 months, at 9 months, you've only had 3 months of growth.
Yeah.
So that can make a tremendous difference on a result. That's why I think a year, 12 to 15 months is fair to say, this is what the result is. This is what it is, good or bad. It's in the middle, but this is what it is. The other thing that people need to realize is that most people are coming in because they have hair loss in an area, and more people are coming in at the beginning when they're having hair loss in an area, but they still have some hair. It used to be less volume, but they still have hair in that area. And anytime you do work, any doctor, no matter how careful you are, using your loops and being very careful, not touching anything during the surgery, not physically any of the existing hair, we have no control of what happens to that existing hair when you go home. And if a bunch of that hair was on the verge of falling out, it was on its last bit of life,
Yeah.
You do a bunch of work all around it, and all those new grafts are vying for blood supply. Some of those grafts are going to fall out and not come back. Now, they were going to fall out anyways, not probably all 1 month. It probably would have taken 6 months to a year organically to happen naturally. But you have to realize that you're being proactive. That was going to fall out anyway. So you're either going to wait till it was all gone and then start replacing, or you're starting to replace as it's falling out. But that affects the results too, because a lot of times, people come in and say, my hair looks similar 2 years after the surgery. And I'll agree, but I looked through it with my loops and I said, you can ask any hair transplant doctor that knows what they're doing if these are transplanted hairs. And almost all of it's transplanted. It's just all the hair fell out.
Yeah.
So their net gain is not that much, but what they have now is staying versus not having anything when it all falls out. So sometimes you got to come in again. You got to tell patients, like, look, if you're starting from scratch in an area, often takes more than one procedure. You didn't lose it overnight. Sometimes you can't fix it overnight.
Yeah.
Or it may be good for a while and then appear to start thinning because you might lose more hair as you get older, like most people do. Then you might want to boost it up again. People need to know that. Just tell people in advance. Don't let people come in saying, no one ever mentioned if I lose more hair, I'm going to want more surgery. That shouldn't be the case. This should be full disclosure. And now most people are smart enough to realize, hey, I'm only 30 years old. I know I could be losing more hair. But I just tell them to make sure that they can't say they were never told that.
You would be shocked the number of guys that I talk to that think that one hair transplant is going to fix all of their problems.
Ever.
They think, oh, look, I want to get one hair transplant. That's it. And, who should I go to? And then and they're usually young and losing a lot of hair. And I'm like, look, I got to be honest with you. For one, you're going to need more than one hair transplant. That's not even disputable. For sure, you're going to need more than one hair transplant. Two, you have to keep, if you want to maintain some hair, you have to get on hair loss medication, because hair transplants do not stop hair loss at all. That's something they need to understand too, is getting a hair transplant isn't going to stop the other hair from falling out.
Right.
So yeah, you could replace hair, but what if you replace hair here and lose hair everywhere else?
Right.
Like, you have to think about that. And you would be shocked at the number of guys that they really don't realize that. So that's why I put together these Instagram lives with, world-renowned hair transplant surgeons like yourself to, educate the public so anyone can watch it, can understand and realize, okay, this is the reality. And then you weigh the pros and cons to whether or not you want to get a hair transplant. Does it matter enough to you? I have to say, for me, 100%, it's been the best thing I did in my life. I would do it 10 times over, but hair mattered to me. It may not matter to whoever's watching this, but something you have to be cognizant of the facts.
Right, I agree with everything you're saying, and I enjoy being on here and answering questions. Again, anyone's welcome to send me questions on my Instagram or through the network. If they're of the network, they can message me directly on the network, and I answer questions on that too.
And
until you have all your answers.
Yeah, just for those of you watching, his Instagram handle is at drglenncharles on Instagram. Glenn is 2 N's.
Right.
And so also, if someone's in the Florida area, they can give you a visit, right, in your Boca Raton office.
We offer in-office consultations. I don't charge for that, and/or virtual telemedicine consultations also.
All right. Fantastic. So thank you, Dr. Charles, for participating. I think we had a...
Take care, everybody.
All right.
Stay healthy.
All right. Bye-bye.
Take care.
Take care.